Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us for our weekly press conference on Delaware's response to COVID-19. We've been doing these press conferences now for over a year. We appreciate everybody joining to keeping up to date on the situation here in the first state. We've got a lot of good news to present today. I'm joined again by Pam, our sign language expert for the deaf and hard of hearing. She's with us each week and on Zoom calls on other subjects on a regular basis. We also have Dr. Carol Rotte, who's the director of the Division of Public Health, representing just a fantastic team on the ground in our state for over a year now, doing great work. And AJ Shaw, who's the director of the Delaware Emergency Management Agency and our point person for testing, which has met the goals that we set for it many months ago. And importantly, most recently, for vaccinations. Today, we have really a lot of good news to report. I think it'll make a lot of people happy across the first state. It certainly makes me happy as your governor. It's based on improving data in our data dashboard, fewer positive cases on a 7-day moving average over the last week, and the expectation that that will continue, in part because of the vaccination rates that we've reached. And thanks go out to all our partners there with vaccinations, the primary care physicians, our hospital systems, the pharmacies, importantly, our public health team, the federally qualified health centers, community organizations across our state. And in particular, I want to recognize Dover Downs Speedway, International Speedway, for allowing us to use their facility, for FEMA for using it the first couple of weeks and showing us the way, and the federal team, and then Diane Hainsworth and Public Health and their team, and AJ, all the people involved, the Delaware Army and Air National Guard. It's really an all hands on deck operation. We've done thousands of vaccinations each weekend for the last couple months, really enabling us to get to achieve our goal of fast and fair that we've had from the beginning, which enables us to make the news today in terms of loosening restrictions here in the first state. We're also seeing and communicating, collaborating with states in our region. They're seeing reduced cases as well. And you've heard some announcements from them. We'd like to coordinate and communicate across state lines so we don't get those cross-border challenges that we've seen in the past. So let's go right away to the data dashboard. And you can see now the positive new cases on a 7-day moving average down to 227. That was very well north of 300 just a couple weeks ago. We've been down almost 20% over the last 7 days and expect that will continue. We also know that with the nice weather, people moving outside, we've learned a lot that outdoor spaces are safer than indoor spaces. And so the expectation that those numbers will continue to improve, particularly as people pay attention to social distancing. Our positive test, again, under 5%. We had peaked up at above 5% there a couple of weeks back. And then hospitalizations, you'll see in a minute. We had a mini peak a few weeks ago down to 128. And then our fatalities continue to flatten out. Everyone is a sad occurrence for family and friends, but with the vaccination protection, significant vaccination protection, you'll see this on the next slide. For the 65 and older population, we're just seeing fewer hospitalizations there, severe illness, and fatalities. Total vaccines administered, you can see, closing in on 800,000. Fully vaccinated Delawareans, 308, almost 309,000. That's 87% for those 65 and over with at least one dose. So those that have been fully vaccinated, closing in on 80% for those 65 and older. So that's one of the reasons, the main reason you're seeing those other data on the decline. And then 53% of Delawareans over 16 years of age who've received at least one shot. We're doing better on second doses for those populations, and fully almost 40% of Delawareans have received are fully vaccinated, which is a really very positive thing. So 53% at least one dose, 40% are fully vaccinated, 87% for those 65 and older, one dose, and almost 80% are fully vaccinated with the most vulnerable populations. There is some difference if you look at the penetration. According to the county, Sussex County leads the way, ages 16 and over, at almost 60% with at least one dose, followed by Newcastle County at 53%, 16 years of age and older, and Kent County at 46%. Notwithstanding the presence of that large vaccination clinic there at Dover Downs Speedway. So here are the data that allow us to make the changes to our restrictions, significant changes at that. If you can see, this is current hospitalizations, a number that we talk about each week. We follow. You can see the peak that we hit back in late April, May of 2020, where we hit a peak of 337 Delawareans that were hospitalized. As we got over there, we imposed mask restrictions, social distancing, closing certain businesses. Everything got a lot healthier, and the number of positive cases reduced, and therefore the hospitalizations went down. As the weather got better, people moved activities outdoors, and through the summer till we hit a low on August the 16th of 29, only 29 people hospitalized in our state. This was before we started vaccinating Delawareans. Then we had the run up pre-holidays starting in November, where the number of hospitalizations was 100. You can see that graph there at November the 1st, where it starts to a steep increase in hospitalizations that rose to as high as 474, which was the peak on January the 12th of 2021, just after the New Year. A lot of indoor activity, a lot of holiday celebrations, from Halloween and Thanksgiving to the December holidays to the New Year. And you can see all that indoor activity resulted in a significant number of new cases, more severe illnesses, and then illnesses that brought people to the hospital at 474. As we started, again, imposing restrictions, keeping people socially distanced, starting vaccinating people in late December, early January, particularly those 65 and older, hospitalizations on a steep decline, down from 474 on January 12th to 99 on March the 9th. And then again, the little mini surge that we saw after March, where we saw an increase in positive cases, an increase in the percent positive of the tests we were doing, and we were doing a significant amount of tests. And then the peaking there that we hope and expect was around 180 on April the 21st. We're down to 128. So from April 21st until May 3rd, we're seeing that kind of a decline. It mirrors, of course, a decline, not exactly, but a decline that we've seen in positive cases. And again, vaccination numbers significantly have been increasing over that period of time, so that now we have a significant, more than half of our population eligible has been vaccinated, almost 40% fully vaccinating. We're getting a more supply, almost outstripping the demand that we're seeing, and that's the case in states across the country. More supply available at local pharmacies, more supply available at primary care physicians, more supply available at state public health clinics, state service centers. And so effective May 1st, we're announcing today that we will loosen restrictions on Delawareans, on mask wearing. Indoor capacity restrictions will be completely lifted. We will require masks, as most states are requiring for indoor activity. We are going to reduce the social distancing requirement from 6 feet to 3 feet, which will, again, help with capacity. And then the mask wearing on outdoors will follow CDC guidelines, which basically are masks aren't necessary unless there's a large a gathering, and significantly large gatherings that, like Firefly, some of the big events we have in our state will require mask wearing and approval from the Division of Public Health, and Dr. Rattay will talk a little bit about that. All this means is, we're telling people that there's not a requirement to wear a mask when you're outdoors and you're safely outdoors, not at a big event. But you need to have your mask in your pocket because you're going to be going indoors from time to time, dropping by the Wawa or the grocery store, places like that. You want to pop on your mask and just be careful about keeping social distancing. And particularly those, if you're vaccinated, you're going to be much more comfortable on all those venues. If you're not vaccinated, we encourage you to continue to do so. We will continue to bring vaccines closer to where you live, and we will want to reach 70%, 80% of the population eligible to be vaccinated in our state. I'd like to be the number one state, not just the first state, and authorizing the Constitution, but also the first state in vaccination, and we have the ability to do that. So we've got good news today across our state, effective May 19th. As I said, this is very consistent with what we've been seeing in states surrounding us. We are always in communication with the teams of those states, so we know that positive cases are declining in their states. Conditions are getting better there. The nice weather is here. It opens out outdoor space for dining and for less risky activity than what we see indoors. So with that, again, I want to thank our public health team and turn it over to Dr. Carol Rattay, the head of that public health team. Thank you, Dr. Rattay.
Thank you so much, Governor. And it really is an exciting day for us. Everything's pointing in the right direction, as you shared with our numbers, our case rates, our percent positivity, our hospitalizations, our vaccine numbers. Thank you to Delawareans who have stepped up to protect yourselves and your family and your community and your state. And additionally, as the governor just mentioned, the nice weather, it does make a difference. More people spend time outside. And so we really are excited about the new announcement today, lifting some restrictions. That being said, we want to talk a little bit more about, with less restrictions, that does mean there's more, personal responsibility on each of us to do what helps keep ourselves and our friends and family members safe. As the governor mentioned, masks will still be required indoors. We have learned the science is so supportive that masks make a huge difference and spread is higher indoors. So for now, continuing mask wearing indoors is going to be important. And for outdoors, the new CDC guidance, really does provide some flexibility, especially for people who are vaccinated, but for individuals who are distanced as well. We feel good about spread being very limited outdoors. That being said, spread does happen outdoors and especially in gatherings. And so when people are in crowded situations, even outdoors, masks will still be required. And although you're seeing a difference in social distancing, allowing businesses to increase capacity by going from 6 feet to 3 feet distancing between people, we just, have to, from a public health perspective, remind people that social distancing does matter, especially if you're not vaccinated. Being more than 6 feet does make a difference, and crowds are risky. So wearing masks in crowded situations is going to remain important. For bars and restaurants, when people are standing or dancing, it's much more difficult to keep a distance, even a 3 feet distance. And so for right now, being seated in bars and restaurants is going to remain a requirement. And additionally, for gatherings that are more than 250 people, those gatherings will still require an approved plan from public health to make sure that masks and social distancing continue to be planned for. Outdoors, as we've been mentioning all along, is safer than indoors. So continue to try to be outdoors as much as possible, especially when you're around other individuals. But the most important thing that you can do is to get vaccinated, to get fully vaccinated. That is the best way to protect yourself, your family, your friends, and your community. So let's shift a little to what we talk about every week, which is our areas of concern. And this is also great news, right? It was just a couple of weeks ago where we had 26 zip codes that surpassed the criteria we've established. Now, only 6 meet that criteria: Claymont, 19805, the Ellesmere area in Wilmington, as well as Townsend, Clayton, Smyrna, and Magnolia. So consistent with the rest of our numbers, it's exciting to see that less zip codes meet these area of concern criteria, but it's still out there. And one of our concerns does remain the variants. So we are keeping a really close eye on this. And this is what we do in public health, and we will continue to do. We'll continue to monitor the data for case rates, and we're going to continue to do a lot of genetic sequencing of the samples, the positive specimen that we're seeing in the state, so we can have a better understanding of what variants we are seeing. And so far, we continue to see the majority are this UK variant, the B117, but also there is a New York variant that continues to predominate. And of the samples that we take a look at, so of the samples that we are sequencing in our public health lab, about 66% still are positive for variants. That is the same as last week. So we haven't seen a significant increase in that number, but still, certainly that wild type COVID-19 virus that we've been seeing for most of the year is now really being pushed out by these variants in our state. So we wanted to talk a little bit about equity and accelerating equity in our state. We have talked often about our efforts to distribute the vaccine equitably among all communities in our state. And we've acknowledged from the very beginning of this effort that we're not where we want to be in that regard. And we have talked about the efforts that we and many of our vaccine partners and community partners have undertaken in order to do better. The governor talks a lot about having a fast and fair approach to our vaccination. And after the first few weeks of vaccine availability in December, January, we recognized that the ways that we could be fast in distributing vaccine, like our large drive-through vaccination events, aren't always serving us as well with the fair goal. So especially from February forward, we and many others in the state have focused on other ways to reach vulnerable and underserved communities through DPH outreach and events, as well as through encouraging and supporting many other vaccinators to focus on these populations. And a key way we've evaluated these efforts has been to compare at the statewide level the increase in vaccinating people in different demographic groups. And by that measure, our focused efforts have shown progress. So on this slide ahead of you, you see what I've been referring to as a growth rate. And you can see, when we started in January, focusing on 65 and older, since that time, we've seen a much faster or more accelerated growth in vaccinations among Hispanics who are seniors, which increased 463%. And while at that same time, we saw an increase of 541% among Black residents, so our comparison would be the white Delawareans, who saw an increase of 296%. So you can see from this that we increased the pace of vaccinations faster among Black and Hispanics than among whites. Now, since we opened up to other age groups, we have continued to see this progress on a statewide level. So between March 25th and April 27th, vaccinations among Black Delawareans who are 16 and older increased by 85%. Vaccinations among Hispanics increased 140% compared to vaccinations among white Delawareans who are 16 and older, which increased by 54%. So these numbers, which we look at internally on a regular basis, have shown us that our intensive and sustained efforts to reach underserved communities has been working. We still know that we have a ways to go to ensure that the percentage of those vaccinated in all groups are proportional to the population share. But these numbers show that we have been making progress after the initial availability of vaccines showed us that extra effort was needed to reach some communities. Let me shift now to talk just about vaccine access in general, which, as we have seen in the last week, the days of people having difficulty finding vaccine really should be over, and it is now easier than ever to get vaccinated. As a result, we are trying to put much of the information about how to make an appointment or where are the walk-in sites all in one place. So de.gov/getmyvaccine is where you can get a lot of great information about Delaware vaccine access. There's a revamped tool from the federal government called vaccine.gov. It formerly was known as Vaccine Finder, which shows the availability of vaccine at pharmacies and medical providers in a chosen area based on the supply being reported to the federal government. So if you're interested, for example, in a specific type of vaccine, you can filter your search to look for just that one. So for example, anyone under the age of 18 needs to get Pfizer. You can sort to find out where you can get Pfizer. So after you find a location with the supply, you'll be directed to that pharmacy or provider's separate scheduling system so that you can try to make an appointment. Also on our website, you can find links to pharmacy and hospital vaccination scheduling system. Again, this is the Get My Vaccine page. For example, Christiana Care, BB, and Tidal Health have all made their online scheduling systems public, so people can make their own appointments. There's also a phone number for veterans to make their own appointments at the VA hospital as well. Our curative vaccine clinics at the Deltec campuses in Wilmington, Georgetown, and Dover are now listed on that page as well and can be accessed by anyone at any time. So rather than just being given that link from being on the wait list, you can just go on that site. And for this week alone, there's hundreds of appointments available in all 3 locations. We have phone numbers and walk-in hours also on the webpage for federally qualified health centers, La Red and Westside, that are offering vaccination in their communities. Additionally, last week we announced that 5 public health clinics have started accepting walk-ins to be vaccinated. And so on our website, you can see the hours and the locations. And as a reminder, our clinics will be taking people without an appointment at these particular clinics: the Porter State Service Center in Wilmington, Williams State Service Center in Dover, Riverwalk State Service Center in Milford, Adams State Service Center in Georgetown, and the Shipley State Service Center in Seaford. So there are appointments open and walk-in options all over the state now. So it is not hard to find an appointment. For anybody who has been waiting or hasn't tried to get an appointment, the time is now. And with that, I'm going to hand it back to you, Governor.
Thank you very much, Dr. Rattay. Thank you for your presentation, talking about our efforts to achieve our dual goals of fast and fair. We have made real progress on that. The team at Division of Public Health and our partners have been really taking extraordinary efforts to take vaccines and get them in the communities. And AJ is going to talk about even greater access now as we take down the large vaccination clinic at Dover Downs Speedway. And again, thanks to all our partners and the Speedway itself. for making that facility available to us. It's really been a godsend, and we've been able to move thousands upon thousands of vaccines into people's arms. Going to make it hard, AJ, to keep up with that kind of facility, but I know you and your team can do it.
Thank you, Governor. Good afternoon, everybody. So first, we'll start with some testing overview. Relatively stayed flat last week, so that was great. We were at 32,400, so just about a 1,000 individual drop from the prior week, but still, it seems like we've plateaued off, and we know that a lot of this is coming from those that have traveled, mandated testing from schools, employers, et cetera. So we are in the testing business. We're going to continue to have our trailers around the state as needed. Walgreens is still an option. A lot of other clinics, in doctors' offices now have either antigen or PCR testing they could offer. So a lot more available now than just this time last year. Check out de.gov/get-tested for the upcoming week's locations. With that, Newcastle County, who's been a tremendous partner over the last really year coming up on this Memorial Day with testing, is going to scale back a little bit over the next few weeks as demand has shrunk, but we'll still have ample access throughout the counties and the state. So with that, kind of go over what the governor's talking about. We had a crazy idea back in January about how could we have something that we stood up that was flexible. It met the demands of the state, and the Dover Speedway was one of those top ideas that came out from our brainstorming session. Now, 3 months later, 77,000 people vaccinated, too many partners to name. I would probably leave one out and then I'd feel bad, but we just know that this is what you call a collaboration. This is what partnerships could do to really help save individuals' lives and get us back to normal, which we've seen taking another step in the right direction today. So really, thank you to the Speedway, and it's great. We're actually talking to the Speedway right now about doing some a booth for vaccination during the race that they're having next week. So a big swing in momentum over the last several months with events in the state and vaccination and access. So as we move away from the Speedway, Dr. Tay hit upon a lot of the access points that we have. And I think that's what we just want to hit home with today. Walk-in appointments are available, curative. So they have 3 sites, Wilmington, Dover, and Georgetown. Georgetown's Thursday, Friday. The other 2 are Monday through Friday. That demand has decreased. So now they're allowing walk-ins. And this is going to be great. The curative sites offer the Pfizer vaccine. So hopefully in the next few weeks, when we get the 12 to 15-year-old approval, lets us really turn that on quickly. The public health clinics, as Dr. Tay hit upon, they're accepting walk-ups across the state. Pharmacies are a little hit or miss depending on their capacity and their reservations, but we know they are trying to be as flexible as possible with individuals as they come into their stores. The FQHCs as well have some walk-up hours. All this information is de.gov/getmyvaccine. So a lot of options. We will continue to look at places where we need to get in the community to help reach those that are hard to hit. We've worked with 3 paramedic services across the state to help get to some individuals that have access and functional needs, and we'll continue to look at unique ideas like that when we find a group or population that cannot make it out to one of our clinics, a pharmacy, their doctor's office, et cetera. So with that, sir, I'm going to turn it back over to you.
Thank you very much, AJ, and thanks to the team there. 77,000 at Dover Speedway. It's a full 10% of the total vaccines administered here in our state over the last several months. A really great idea from you and the team and Diane, and great execution, men and women at the Army and Air National Guard. You mentioned the paramedics in the 3 counties came up big. It's just been an unbelievable idea. I forgot Del.Dot. I mean, as you say, you're going to forget somebody, and it's such a huge team. You can see, if you could see close enough, that picture with all the people there from the drone, it gives you an idea about how the big team was. But, obviously a big challenge to replace those vaccines as demand is declining a little bit. But we'll be taking it back to communities, a community near you. It was easy, though, for me. I got both of my vaccines, just finished up 2 weeks ago with my second dose at Dover Downs Speedway. Drove down. Took me about a half hour, not even, to get through the line, get checked in, get the shot, wait for 15 minutes, make sure everything's okay. and then you're back on your way. Now we'll be bringing vaccines closer to home and to populations that have been a little bit hesitant. And I'm encouraging all Delawareans to talk to other family members, other friends of yours that are a little hesitant. It will help us all if people are actually protecting you if they're not vaccinated, protecting others, maybe family members of yours. It's really one of those, we're all in this together, let's get vaccinated, and we'll be in a much better, much safer place. We're getting now to the nicer weather. It's been beautiful the last couple weekends, obviously, and people are spending more time out there outside in our beautiful natural areas, parks and beaches across our state. And as Dr. Rattay says, much safer there. So we're prepared to loosen the restrictions effective May 19th, and hope to have a really happy summer without a lot of the stress. I can tell you the stress and anxiety that I felt pre-vaccination is a lot worse than what I feel now. I feel just a big relief when I got that second shot. And I know I hear that from everybody else. So make sure you get your vaccine. Sign up today. Go to a walk-up clinic. You can sign up at de.gov/getmyvaccine or call 833-643-1715. Newcastle Countyans and Kent Countyans, we got to catch up with Sussex County that's leading the way in terms of the percentage of their population that's vaccinated. If we all get vaccinated, we'll be a much safer, happier place. So thank you, everybody. I know we have media on the line, and we appreciate you attending again and look forward to your questions.
All right, first we'll go to Amy Cherry with WDEL.
Hi, everyone. Thanks for taking our questions today. First up, wondering, with demand decreasing, has Delaware ordered all of the vaccine doses that are available to it? And are you concerned about vaccine waste?
Yeah, so we're concerned about vaccine waste. I'll let Dr. Rattay talk about that. Both of those subjects, Amy, were subjects for the White House call this morning. I believe it's the case that we have taken our full order to date. Whether that'll be the case each Tuesday, you can start your order, which will be recognized on Thursday. We've taken down our full order so far. Demand, as we've said, is declining, so we'll have to see what our partners want for next week, and we make that decision on a kind of week-to-week basis. What the White House has said, if you don't take down your full allocation, they will put it in a pool, which will be made available to other states that may have the capacity to utilize that vaccine. I got the impression that sometime later you could come back and acquire what you gave up in that pool, although that was left a little bit up in the air. There is a federal pharmacy program, frankly, that has made it more difficult for us to meet our equity goals because their numbers they're not as intentional as we are, and their numbers are not as good. It is the case, even though Governor Sununu in New Hampshire and I both asked if the pharmacies were taking down their allotted capacity, could they go into the state pool to be allocated to each of us? And the answer to that this morning was no. We obviously are interested in seeing unused vaccines that are allocated to pharmacies through the federal government to Delaware be used effectively and fairly. So we'll see. I think, Dr. Rattay or AJ, do you have any sense as to where we might be for the coming week in our allocation?
Yeah, so I'll answer first, and AJ, please feel free to add in if I miss anything. We have ordered all vaccine available to us to date. That being said, we feel it's very important that we are good stewards of this public good. Our focus, while we have seen a decreased demand at some of our own clinics and our partners have been ordering less vaccine, we're really pivoting our strategy to really make it easier for people to get vaccine. So we're going to keep focusing on this new strategy of making it super easy, like walk-in clinics and looking at events in places where people are located to just simply make it easier for people to get vaccinated. That being said, you ask about wastage, and when we were in a period for months of where demand was far exceeding supply, we did everything we could. We treated this vaccine like gold, and wasting a single dose was completely unacceptable. Now we are pivoting to a different place where if we want to make it easy and accessible for people with walk-in clinics, you don't always know how many people are going to show up on a given day. And what the White House said today and where we are with this is it's what's most important right now, especially when supply is exceeding demand, is get vaccine into people when you have that opportunity. We don't want to waste doses. On the other hand, we want to take advantage of every opportunity when a person's ready for a vaccine to give them that vaccine.
Let me just make a clarifying point. I think I said May 19th for the new restrictions. That's May 21st, a date I should remember because two of my sisters have that date as their birthday.
Okay, and second question that I have is Pennsylvania's governor has indicated that he'd be willing to lift the mask mandate once 70% of the population is fully vaccinated. Do you have a metric you'd like to see in your mind that we could get to, that you'd feel comfortable lifting that mandate? And are you afraid we may not get there due to any vaccine hesitancy?
Yeah, I'm not sure what Governor Wolf has said with respect to that. We did have, Dr. Fauci did have a lot to say about herd immunity, is what he referred to it, and his basically he said that the scientists have not determined what percentage would constitute herd immunity. One, because you don't know about the effect of folks that have previously had COVID-19 and how long any protection there persists, as well as the persistence of the vaccine, to somewhat open questions. And so his recommendation was don't focus on a particular number, focus on getting as many of your people vaccinated. And that's really our message, whether it's, I'd like to have more than 70%. We didn't want to make anything based on meeting a certain percentage for lots of different reasons, but not least of which is that we don't have a strong feeling, science-based feeling about what that number should be. We are loosening significantly mask wearing requirements outdoors, as particularly this time of year, as should be the case, and asking people to be personally careful, particularly if they're not vaccinated when they're indoors.
All right, next we will go to Nick Cialino from Delaware Public Media.
Good afternoon, everyone. Governor, you answered this a bit with that last question, but I'm curious if you'd be willing to talk a little bit more about the decision to leave some restrictions in place. As you mentioned earlier, this is the route most states are going towards, but I'm curious, given some of the things you mentioned, lower case rate, the vaccine being widely available, and a year into the pandemic, people being aware of the risk, at what point should decisions like mask wearing and social distancing fall on the individual?
Yeah, I think we're moving to that point, Nick, for sure, and clearly with respect to outdoor spaces, because mostly if you're outdoors, you don't need to wear a mask unless you're in a big crowd, right? And obviously when you're outdoors, you're going inside and outside, so it's important people keep a mask with them. So if they can stop at the grocery store, stop at the Wawa, or whatever the case may be, they have that mask with them. We're clearly moving. This is the biggest step towards loosening restrictions that we've had in the past year, and it's primarily because of the number and rate of vaccinations. We still need to do more, and 70%, 80% will be way better than 40% as we are now with fully vaccinated, 54%. partially vaccinated, and 85% of our most vulnerable citizens that have at least one dose of the vaccine. We also expect that the supply of the Johnson & Johnson single dose vaccine will come back. It will come back strong. It will enable us, I think, to reach those objectives, and in particular to reach our equity objectives, and that'll be a big part of it, and something again that we talked about on the White House call this morning.
All right, and then for my second question for Dr. Rattay, I'm curious, has the state approved many plans for high school graduations? And if so, does today's announcement change those plans at all?
Yeah, so I can't tell you, Nick, how many plans have been approved for high school graduation, because I know high schools have been working on these plans for quite some time. I know that some have been approved, but today's announcement will allow many of these schools to have more flexibility. So my guess is we'll probably get some revisions to some of those plans that have been submitted. At Public Health, we will continue to work with the schools to take the safest approach possible moving forward.
All right, next we'll go to Katie Tabling from Delaware Business Times.
Good afternoon. Governor Carney, I just wanted to ask, in your announcement comes on the heels of decisions made in New York, New Jersey, Connecticut. Maryland obviously has had its own system for restrictions for a while now, and Pennsylvania in its recent decision today. I'm just wondering, how much did all these surrounding states of Delaware lifting restrictions play into your decision to lift some restrictions?
So it had nothing to do with it in this sense. First of all, the main reasons were the data in our state. The number of positive cases going down over a 7-day moving average, 7-day period from week to week. Hospitalizations, again, trending down, and at really a low level relative to where we've been. Vaccination rates significantly up in the number of Delawareans and percentage of Delawareans. So fundamentally that was, and then the second part of that is that we're moving into the warmer months where people are spending more time outside. And we've learned over the last year with COVID that outdoor spaces are much less riskier than indoor spaces. And so with more people moving outside, just look at our graph of hospitalizations and you can see the decline in cases last spring. After there you have it. And you can see the summer months where they're just flat as a pancake, and not till people started moving back inside. And you also know that during that period of time, we weren't vaccinating. We didn't have an improved vaccination program. And so you can see that little hump. We've just been through that. We expect it'll continue to go down. We also know a factor clearly was that the states around us that are getting healthier too. So it's not just our data. We're a small state with porous borders, people coming back and forth. And so their positive cases are going down, the severity of their cases are going down, and vaccinations are going up. So that's part of the equation. And then finally, we know what happens when you don't, there's not consistency among the states in a region you have cross-border problems and challenges that are created. We've seen that both on the northern border around Newcastle County, in the Claymont and Delaware County way, Chester County, Hockessin area, and then the lower part of our state with the beach communities. And so being somewhat consistent as long as the health conditions are similar across borders makes a lot of sense.
Do you see any possibility Delaware may have to roll back for more restrictions in the winter months if COVID continues to persist?
That's why we continue to push and focus on vaccination. If we can get our vaccination rate up to 70+%, considering that 100,000 people have already tested positive, that's 10% of our population, we'll feel much more comfortable to be able to continue. People may voluntarily, I might decide to wear a mask. By the way, last winter, we had a non-eventful flu season. In fact, our children's hospital had hardly any cases, severe cases of the flu among children who normally would be coming into the hospital. That's a tremendous benefit of voluntary efforts and, in that case, mandatory efforts to wear a mask. So there's another benefit to that. But no, I expect that our vaccination rate will continue to increase. We're going to really lean into it. We rely on Delawareans to encourage their family members and friends to get vaccinated so that we can be more open and free.
All right, next we'll go to Brandon Holbeck from the News Journal.
Good afternoon. It seems like we're getting close to at least the Pfizer vaccine being approved for kids 12 to 15 years old. I'm curious what the plan will be for them to get vaccinated if that does come through here shortly.
Yeah, it's a very exciting possibility. It was a subject of discussion on our White House call this morning, and I know Dr. Vertay and her team have been looking at it and preparing for it.
Yeah, so we are super excited about it. And we have built a really great system in Delaware with partners to make it pretty easy, to make it very easy to add this 12 to 15-year-old population into the existing system. So health homes, medical homes, are a great place for children to get vaccinated. We know Nemours serves a lot of children in this state. They're ready to go. So if you are or if you're not a patient there, you'll be able to have access. At our public health clinics, we provide Pfizer, and I probably should take this moment to again reemphasize for the pediatric population at this point in time, anybody under 18 will be getting Pfizer. So we'll be providing a lot more details, but the places where Pfizer is available, we'll make sure that they are ready for this pediatric population. So that includes our public health clinics, that includes curative clinics, and a number of other partners in the states. But we're ready for it, and we're excited to get to expand access to this population.
It's also important to note, Brandon, that the school districts, many of them are doing a really good job getting their students vaccinated. The report that I received from Dr. Asanis just this week, University of Delaware doing a really good job of vaccinating their students on the White House call. The governors have talked about reciprocity across states, and if a student gets vaccinated at a college in one state, that they could get the second dose in their home state of residence. And so we're really excited about that as well, and want to thank University of Delaware and Del State University as well for vaccinating their students, whether they live in Delaware or not, making those communities in central Kent County and Dover and in Newark area safer for all of us.
Might be a little bit early for this next question, but just thinking about that 12 to 15 age group, or maybe even people younger than that getting access to the vaccine, how will that at all change what next school year would look like if a significant portion of those people can get the vaccine before August and September?
Yeah, so I'll let Dr. Rattay handle it, but I would say everything we do to get staff, teachers, students vaccinated will make it a lot more comfortable and a lot easier to get our students and teachers back full-time, a full in-person instruction, which is our objective, will continue to be our objective. School districts across our state have proven that they can do it, and we're confident that we'll be able to do it as well. Getting more children vaccinated will help us do it safely and with a level of comfort that is necessary by all concerned. I want to thank all the educators that have really worked hard in a very difficult way this last year, and the districts in particular that have stepped forward to pave the way, if you will, for bringing the children back to in-person instruction, because we know how important it is, not just for the children's academic performance, but also for their psychological needs as social beings. And Dr. Rattay talks a lot about that as a former pediatrician herself. Dr. Rattay, any thoughts?
Yeah, I mean, it is one of the reasons why we're so excited that this approval is imminent for Pfizer for 12 to 15. I mean, at one point we thought it wasn't going to be available till late summer and fall. Now, having some time before the school year starts to get as many of these kids fully vaccinated is going to be huge. When we look at infection rate and infection spread, when it comes to the pediatric population, that 10 to 18-year-old population is where we see more spread. The younger kids, less spread. I'll take this as an opportunity to emphasize what we're seeing in the data for these younger kids. Oftentimes when they get infected, and our data are showing this over and over again, it happens at home. It happens often from a parent being infected that spreads it to the kids. So two of the best ways we can make our schools safer and we got to get our kids back there to school is for all parents of kids to get vaccinated. And now that 12 and up is soon going to be available for all 12 and up adolescents to get vaccinated. It's going to make a huge difference.
It's also important to remind you, Brandon, that over 70,000 Delaware students are back for in-person instruction for some period of time during the week, and have been now since our goal of getting them back starting in mid-January.
Right, next we'll go to Tim Mastro from Delaware State News.
Hi, everyone. Good afternoon. I know we talk a lot about restaurants. I wanted to ask how this would affect gyms, though. If you can just confirm, you still have to wear a mask while working out, and how this affects the size of fitness classes and things like that.
Dr. Rattay?
Yeah, so it will allow for more individuals in fitness classes going down to the 3-foot distance. Just a few weeks ago, we went down to 6 feet, and now with these new restrictions, more individuals will be able to get into classes. But as we've also discussed, gyms are an area, whether in Delaware or nationally or internationally, where there've been super spreader events and in general, a fair amount of spread because people exhale hard, and the vesicles can spread even further. So at this point in time, the indoor mask wearing is going to be important for those who are working out.
All right. And then I'm just wondering, how will DPH still make sure their places are still enforcing these rules as places become more and more crowded in terms of mask wearing or customers remaining seated indoors? Will there be any enforcement actions that will be taken for any violations?
Yeah, so like all along, Jamie Mack and his team are, always willing, ready, able to work with businesses to make sure that they have a good understanding of what the restrictions look like and how to enact those in their place of business. However, for those who are not following the rules that are in place, we do get complaints, and our team does go out and check out the situation when that happens.
All right, we just have one last question. This was pre-submitted from Chris Barish at WHYY. He asked, are you really satisfied that barely half of eligible people age 16 and above have had one shot? Should we be higher at this point? And why aren't we close to leading? And why isn't this percentage higher?
Well, the main reason is we haven't had the supply. We have, as an answer to an earlier question indicated, taken down all our allocation. The biggest concern that I have is, our goal has been fast and fair. We have, I think, met our goal of fast. I think we're still pursuing our goal of fair, and that's a function both of numbers. You know, when we have a large clinic, we make appointments available from our registration list, and our registration list requires a certain amount of sophistication online and signing up. That list improved from about 5% diversity to 15% diversity. And so things got a lot easier to make those appointments available to communities of color. We're also seeing a lot of vaccines, federal vaccines, going directly to the pharmacies themselves, and they don't have any outreach efforts. The outreach, shouldn't say any, they do partner with us on doing some, and they've been great partners. Albertsons with the school districts, Walmart with us and some of the larger clinics. But it's been our intent in going out and getting folks from Black and brown neighborhoods to attend, and we give out vouchers and appointments for those clinics. So we've taken advantage of the allocation of vaccine that we've received. We haven't turned any down yet. Would I like to be at a higher level? Yeah, if we had more vaccine, I'd like to be at a higher level. Am I happy with 50%? I think we've made great progress, and our team and its partners have made progress there. But our hope, and all of our hope of everybody on our team, is to get to 70%, 80%. At the end of the day, that's when I'd like to be on the top among states for the rate of vaccination. Right now, we're a little bit past halftime, maybe in the third quarter sometime, and there's still a lot of game to play. And we look forward to playing hard and reaching the goal line with vaccinations and leading the country at that. We've made great progress. We've got great partners, and we're at a place where we can translate those gains on the vaccination side into a loosening of restrictions so people can have a more normal way of life. So I think that was the last question. Is that right, Haley?
Yep, that was the last one.
So again, thank you all for joining us. We appreciate your attendance over the past year, your interest in the data, your interest in our approach to containing COVID-19 in our state, to beating COVID-19 in our state. And I think it's fair to say today, with the loosening of these restrictions targeted for May the 21st, it's a brighter day for all of us. We're looking forward to this summer. We're looking forward to the beautiful days in the outdoor spaces here in our first state, out on Delaware beaches, enjoying good meals at our Delaware restaurants, and just lowering the anxiety level for everybody in our state. I want to thank everybody for leaning in. We're not over. This is not over yet. We're not through this, but we've reached a new level, and we want to thank all of you for helping us get there. Thank you very much, and we'll see you next week.